Can you give us a sense of what your reaction is to this very disappointing survey result?
Yeah, I would say what was not disappointing is I think the survey accomplishes what we set out to do, which is to indicate that our organization is ready to turn the corner. So I've been brought in as an interim leader to do things differently as of July, quickly engage Dr. Flynn, and want this to be a completely transparent process where we give the community a voice.
But at the same time, you guys have a long
Absolutely.
haul ahead of
It
you.
is a very difficult challenge, a very difficult reputational challenge, and I think we have to absolutely start by doing things differently. So I think there's an acknowledgement on leadership that we need to analyze this data and figure out what we need to do differently to improve the relationship and reputation of this organization.
Are you hopeful that you will be able to improve this relationship? I mean, there's some pretty negative numbers.
Yeah, I mean, thankfully, back to Dr. Flynn's point, I think where what he expressed today is where the service was good, we have a good reputation, and there are people in the community that are very engaged and very willing to come to the table again and try to work this out with us. So that gives me great hope.
Were you surprised by any of these numbers?
I think they were more negative than I had expected. I think this is a good validation for the people in the community that had previously thought maybe this is, an active minority that is dissatisfied. I think this is a very clear indication that we have a more widespread and deeper challenge than was previously expected.
What's the first step? What is the first thing you guys are going to do to try and make things?
Well, I think the first thing we'll do is by speaking to Dr. Flynn to interpret the results and figure out an action plan very quickly. I would actually argue we have taken the first step insofar as we made this a very transparent process, and we have recommitted to wanting to heal this relationship. So I hope that will be felt by the community members that see this coverage.
What about this notion of misinformation that's the community you guys have had very limited success in trying to overcome? What do you think the NHS has to do, and I guess your department in particular has to do to try to overcome?
Yeah, well, certainly on the issue of access to emergency services, I think that's probably the foremost challenge. And so I think we're going to have to go back and rebuild a communications plan that very clearly articulates to everyone in the community where the services are, how they access them. And another important point is when you should call an ambulance as opposed to driving yourself to the ED.
How would you describe the culture before things changed in the summer? I remember Sue Matthews saying that this is a new culture now. Obviously the supervisor was appointed. What was the previous culture that led to all of this?
I wasn't here actually, so I was only brought in July. But what I can say is that I think what characterizes the new culture is commitment to improve our relationships, commitment to do better, commitment to apologize when we're wrong and to try to fix things. So, and then I think maximizing transparency in our relationships with the media, critically important.
Now, I know you weren't here, but obviously you're dealing with problems that precede you, so you must have some understanding as to what created those problems that you're now trying to combat.
Well, I think the survey results, to me, they speak for themselves. It's very clear where the relationship challenges are, so I think we're going to go directly to the results to determine what were the previous problems and how do we fix them.
What are you going to do to help improve the communication between the public and the Niagara Health System?
We've already taken some very significant steps primarily with the media. So we've struck a media advisory committee, which I think is critical. I think the majority of the public are getting their information from the media. So I think the more we're hearing from the media about how we need to communicate with them, what kind of information needs to be made available, I think that's very important. I think a second and probably even more important angle is our individual interactions with patients and their families. So when we have a complaint or any sort of challenge with a patient family, it's how we interact on an individual basis that I think has ultimately led to the challenges we're facing today. And that's where we've got to put a lot of energy.